Alright, what is going on, guys? Yeah. What? Welcome back to another video. It has been a little bit of time, maybe a month or two since I posted my last video, but I just wanted to hop on here and I'm kind of talking with a lot of energy right now, but that's not really how I've been feeling lately. I just wanted to talk to you guys today about the importance of your own health and well-being as a provider or as a student that's going to become a medical provider in treating patients. So this really is for anyone that's a medical provider or providing any type of patient care, and really stressing the importance of your own health and your own well-being. So you're probably wondering, like, why am I talking about this? Generally, when I have different topics like this that I speak about or make videos about, it's because I'm going through it as well. So I'm kind of speaking from the heart and speaking from my own personal experience. Obviously, this video is to help you guys and to shed light on really the significance and how much your own health and your own mental kind of capacity and well-being is in terms of how you treat patients, how well you treat patients, and how well you operate in the clinic. I've been going through some stuff, and I don't want to get into too much specific, but it has, weighed pretty heavily on my heart, and it's personal, it's relationship stuff and all that stuff, but it's really hard, and it's very eye-opening to see how much that can play a role in how I treat patients and how I've been treating patients recently, because when you're not, mentally right here or here, it's really hard to be on the top of your game. And especially as a provider, you want to give your full 100% to your patients, and when you're not, physically well, mentally well, emotionally well, or spiritually well, it's hard to do that. Yeah, I've been kind of in a rut. I don't deal with things out of my control very well. Try my best to stay positive. That's really the most you can do in terms of things that are out of your control, and you want to shift your perspective and really try to reflect and see how you can improve or deal with the situation. So, like I mentioned, I've had, things that are really heavy on my heart, and I've been kind of very drained in clinic the past, week or two. It has nothing to do with my patient, it has nothing to do with anyone in my clinic. It's all, internal. And for me, I wear my heart on my sleeve, so you can 100%, 1000% tell when something is wrong with me. Obviously, I'm still a nice person, at least I think I am, but you can tell my tone and my uppity beat is not like it normally is, per se. So in terms of dealing with your own struggles, emotionally, spiritually, physically, it plays a huge role in how you treat patients. And the really big component of it is it really affects your focus. Like I mentioned, when you're not 100%, you're not able to treat or provide care for someone at 100% of you. And an example I like to give is, say someone is a basketball player and they're injured. They're not able to give their all for the team, do the best that they can do because they have an injury. So that's more of a physical thing, but when you deal with mental, spiritual, emotional things, that weighs really heavily too. I think even more so than physical aspects. For me, I feel like relationships, dating, that kind of stuff, stress, anxiety, that can really turn your world upside down and affect you in a way that you're unable to really comprehend why it's happening, or what you can do to solve it, and that really affects your focus and affects your focus at work as a medical provider. It's really tough to be clear-minded when you're going through something. For me, when I'm going through that emotional and spiritual, struggle and adversity, I get anxious, I don't have an appetite, I'm just constantly worrying, and I'm trying to stay busy, but even staying busy, it's just a constant worry. With all this COVID stuff, I know a lot of people's anxiety, I know a lot of people's struggles have increased, and we're kind of at a standstill. And for me too, like, I've lost my appetite, and even the last 2 months I've lost 10 pounds, not like my normal self. I don't have an appetite, and this is not intentional 10-pound weight loss, because you guys know me, I'm like slim, I'm trying to gain weight, but not having that appetite, because you have that kind of gut-wrenching feeling is so hard because, you know, you don't want to eat and you don't want to really do anything. So the biggest thing, like I mentioned, that is affected is your focus. Especially you're not clear-minded, you've got things that are heavy on your heart that you're struggling with, and your focus is shifted from, you know, your patient that's in front of you to dealing with some of these things internally, you know, but obviously trying to treat your patients as well. The other big component that I think gets affected is your compassion and your empathy. What do I mean by dealing with your own struggles? How does that affect your empathy and your compassion? My perspective, and I feel like kind of from my own personal experience, my patience is a little bit shorter and I'm not as understanding, and things may seem a little bit more trivial, or, you know, they don't seem as of a big of a deal, or you don't take things seriously. You want to be as compassionate and empathetic to your patients as possible. You know, we all go through our own struggles, we all go through our own adversities, and you can't downplay anyone else's struggle, and you yourself cannot downplay this, you know, the things that you're going through. Compared to other people, you know, it may seem like it's a lot easier or a lot worse, but there's really no comparison because every individual has their own kind of identity and, you know, personal experiences that they're going through that you can't compare. In going through this emotional struggle, I feel like I am more sensitive and a little bit distant. So when I'm normally on the top of my game, I do try to build that personal emotional connection with my patients. You know, I want to feel how they feel. I want to know, you know, what kind of pain, how much pain they're in, things like that, and how, you know, what can I do to help them. Dealing with my own struggles, you know, again, the focus is shifted, so my compassion, my empathy is not fully there as well. So obviously I'm not like super cold, or, you know, I disregard anyone's, you know, complaints, but, you know, it's hard to be as fully empathetic as I would want to be. I'm not saying I'm doing things wrong necessarily, but empathetically, compassionately, I probably could be a little bit better, because some of my focus, my mentality is like focused on myself and my, you know, adversities and the things that I'm struggling with. It takes away from me trying to grab and understand my patients. You know, I am very professional at work. You know, with my patients, I don't think anyone in the past couple of weeks has noticed that, you know, my tone or like my mentality has changed. I do still do my best to, you know, do the right treatment, the right course of action for my patients. Internally, it's hard because you're kind of bottling it in, and especially with the social distancing going on, I can't see friends right now, really. Things are opening up, which is, you know, hopefully the right thing. And with all of this going on, I have that higher sense of loneliness, and especially when you're dealing with like emotional stress, emotional problems, you really want someone there. I do like being around people. I do like having that connection and that physical touch with people. So even just, you know, hanging out with friends, and it's been taken away and hasn't been there for the last 2 months. So that's something that's, you know, kind of not helped the situation at all. So focus and empathy and compassion are all things that I feel like get affected when you're personally struggling with your own struggles and adversities and emotional, you know, circumstances. But what can we do to alleviate that? What can we do to reflect? What can we do to help in this situation? Just to throw this out there, I know a lot of companies, a lot of clinics, hospitals provide resources, apps, different daily emails, meditation, mindfulness practices to help you get through these exercises, or help you get through these stressful times. And I think those are, you know, good things to incorporate, because it kind of is a broad net for everyone, and it doesn't really, it's not a specific thing, but it can apply to anyone in anyone's situation. So I think that's good. But also it's almost a little bit too distant. It's not very specific. So some people are like, I don't want to do it. Like myself, I'm like, I don't know if this is going to help per se. You know, another thing that I think is important is talking it out. And me talking with you guys now, it is helpful for me to listen to myself and hear myself talk about this, because I've been struggling with this for the last couple of weeks, for pretty much all of May, and the situation that I'm in, and it's been tough. I've had nights where I just can't sleep. I have that gut feeling, you know, like my heart hurts, and I'm so focused on this one individual that everything that they do essentially dictates how I'm feeling. I know that sounds crazy, and it probably is, but you know, when you get emotionally attached to someone, or you do like someone, you know, the feelings are, you know, crazy high, and things are just not normal. you know, and you act irrationally and you do things that you don't normally do, but because you really care about someone, things like that happen. You know, for me, I think the biggest thing that helped was, you know, talking with one of my friends who's very, very level-headed, gives really amazing advice, and doesn't really necessarily pick one route or the other, but really helps walk me through kind of the, you know, process and mindfulness that I need to be doing. And that has helped, but again, it doesn't take the feeling away, and for me, that's okay. For me, I feel like time is the biggest thing that will help, and keeping yourself busy, keeping yourself physically well, spending time with loved ones. I know that although that's hard right now, but constant communication with people that you care about is gonna help you get through these times. And again, just to reiterate, I don't want you to compare your struggles or your circumstances or your adversities to other people, because, you know, I don't want you to downplay anything, you know, any of the emotions that you're feeling. And I want you to really reflect, think about ways to improve, think about ways to handle the situation, grow from this, because that's the most important thing, is growth. Are you better than you were yesterday? Or how can you do to, you know, prevent this from happening? How can you shift your perspective? Because perspective is really a lot of how all of this is dictated. If you're having a positive, grateful, thankful perspective, it's hard to feel bad. And for me, I think I need to incorporate that more. For me, I'm a religious person. I'm Christian. I grew up Christian, even without my parents, you know, forcing that on me. I am a Christian believer. I do need to pray more, and I think that is really something that can help me, is to get through all of this, is to pray more, you know, talk to God. Help me to really just be more mindful and reflect on the situation. Don't get too high-strung. Don't make irrational decisions, because I feel like I have in the last couple weeks. And to anyone I've, you know, affected that way, I apologize. I sincerely apologize, because I'm acting out of love and caringness as opposed to just being a psycho. But I need to really reflect more and focus more on the positive, focus more on the thankfulness and, you know, gratitude aspect of this life that I'm living. So again, I just wanted to share your own health, well-being, mentally, spiritually, emotionally, physically, is so important in terms of how you treat your patients. And, you know, the highest level of care you can treat your patients with, you want to be at 100%, or, you know, at least close to that. You know, we all are always going to have struggles. We're always going to have things that we go through, but it's how we handle the situations, how we really grow from the situations, and, you know, see those situations and take action. Thank you guys for watching this video. I do appreciate you guys, you know, sticking to this far. Don't forget to be like my blood type, be positive. Subscribe if you haven't already. Please like the video if you know, found it any bit helpful. This definitely helped me kind of talk things out as well. So hope to see you guys in the next one. Peace.